According to the book Guatemala in Focus, Guatemala leads Latin America in illiteracy, infant mortality, lowest infant birth weights, lowest doctor-to-patient ratios, and lowest percentage of children enrolled in school. The statistics are significantly worse for Mayans compared to Ladinos in all the above categories. Because of this trend, many Western nonprofits have stepped in to try and change the situation of the indigenous people. However, before one can look at both the benefits and disadvantages of Western nonprofit influence on the preservation of indigenous cultures, one must first look at the factors that have affected the situation of the indigenous people today. Historically, the indigenous Mayan people have been oppressed, first by the Spaniards in the 16th century and later by their descendants, the Ladinos of Guatemala. In addition, the Mayan people have been subject to frequent attempts at conversion to Christianity, namely by Roman Catholics, which threatens the survival of their indigenous Mayan religion that has persisted for centuries, despite the Ladino mindset that views the religion as inferior. Although they have an array of vibrant cultures and cultural systems that have allowed them to survive and endure for centuries, the Mayans have long been considered substandard because of their racial background. This inferiority has led them to have less access to education, higher rates of infant mortality, lower life expectancies, poorer health, and in general fewer opportunities to things Ladinos feel entitled to. Mayans living in Guatemala are generally lower class and poor, while Ladinos dominate the upper and middle classes. Mayans have long been exiled to the mountains of Guatemala, some of the most difficult and remote places to get to in the country. This exile has happened for a couple reasons. First, land is a luxury for poor Guatemalans. For the lower classes, which include most Mayans, the only cheap and available land is in the rough mountain terrain or the slums of the cities. Second, during the Civil War, the government army persecuted the indigenous people, and many were forced to flee to the mountains to escape. Although this exodus allowed many to survive, it has also caused many indigenous communities to be cut off from outside contacts. For this reason, many indigenous children have little access to formal education, and the communities are cut off from access to Western healthcare. Many Western nonprofits are dedicated to the formal education of indigenous children, which holds several important opportunities. First, it allows the children to know their rights. Because indigenous children often are accustomed to being considered inferior and have not been taught their value to the country, they are often ignorant of their basic human rights. Having access to formal education allows the children to learn their rights and regain some of the confidence and sense of importance they may never have known. Knowing that all people are created equal and that everyone has the same basic rights gives the children the self-assurance needed to stand up for themselves. In addition, education is most often the key to breaking the cycle of poverty in Guatemala. Poverty is a severe problem all over the world, Guatemala and the United States included. In both countries, jobs that require education are generally higher-paying, stable jobs. Unfortunately, poor families often cannot afford to let their children go to school because the income the children bring in is so valuable. Short-term income is more necessary than going to school and gaining a more stable, long-term income. However, once children have the skills they need to perform work beyond labor on a coffee farm or weaving every day, they have the opportunity to get a job that will allow them to raise a family with less chances of poverty. Many of the poorest people in Guatemala do not have stable jobs. Depending on the weather, the economy, or tourist interest, a family may not have any income if the variables are not right. When a child receives an education, he or she also receives the benefits of a stable job and income. Although education does not always lead to the disappearance of poverty, it does provide a steady income and a sense of assurance that money will consistently arrive. Along with the opportunity for a wealthier lifestyle, formal education brings the leveling of gender roles. While in most parts of the world some form of gender inequality remains, for the indigenous people, traditional gender roles are very much in place and enforced. Women are to stay in the household while men perform hard labor to support the family. For many children who have not been exposed to alternate ideas, there is no way out of a traditional gender role. A girl who wants to own a business may be denied this opportunity because of her community's beliefs. Gaining access to Western or formal education exposes the children to the idea that boys and girls are equals, who have the same rights to education and work opportunities. Western nonprofits that support the education of girls and women give them the opportunities for education and jobs they may otherwise not have had. Many of the nonprofits that work in Guatemala are dedicated to improving the health of the indigenous people. In general, their health is much worse than that of Ladinos, either because of less access to healthcare, because of traditional beliefs that do not allow room for Western healthcare, or because of a fear of Western healthcare. With the help of Western nonprofits that work toward bringing healthcare into indigenous communities or educating the communities on the benefits of Western healthcare, Mayans are seeing the advantages. Fewer infant and maternal deaths, along with fewer diseases and better nutrition, let Mayans enjoy the healthy lives that Ladinos have had for a while. However, how much of the influence that these nonprofits exert on indigenous communities is truly beneficial? Are they in fact hurting the communities more than helping? While surely the nonprofits have no intentions of harming the communities they work with, it is possible that this is indeed what is happening. First, although in some ways traditional gender roles have a negative connotation because of the constraints they put on women, for Indigenous communities, many times these gender roles make sense and are, in fact, necessary for survival. For example, in the small mountain village of Cowetz, it was the man's job to chop firewood and work in the fields, while the women stuck to household chores such as washing clothes and making tortillas. Sometimes, certain chores are simply easier and better suited for a man's or woman's body. Men, who are generally larger, have more strength and have been trained in hard labor, have an easier time chopping firewood and can do it faster. Women, who have smaller hands that are more adept at tackling small chores such as sewing, as well as the background training, are better at these skills. In a situation where daily survival is dependent on the completion of simple tasks, the person who can do these tasks best and quickly is the one who is assigned to them. It is necessary to have an organized system to ensure that these tasks get done, and assigning them to each gender is an easy way to do this. While Western societies who have the privilege of washing machines or pre-cut firewood may find fault with gender roles, in societies where every seemingly little task is a big job, gender roles can make sense and help the community survive. Gender roles are not set simply as a tool for oppression, but rather as a tool of day-to-day living. By telling Indigenous children that they do not have to stick to traditional gender roles, are Western nonprofits in fact undermining a complex and necessary system of survival that has been in place and worked for years? Western nonprofits often try to bring Western healthcare in place of traditional Indigenous healthcare. Unfortunately, Western medicine is often perceived as easier and more effective simply because it comes from the land of white, rich, formally educated people. The art of traditional medicine is being lost on younger generations, and ancient remedies threaten to go extinct because of a lack of interest in becoming a healer. However, many times Indigenous healthcare works just as well, if not better and more quickly than Western healthcare. It is cheaper because the herbs and plants needed are available for free in the rural areas of Guatemala, and Indigenous medicine has been passed down for centuries because it actually works. The author of the book Healthcare in Maya Guatemala tells a personal account of how traditional Mayan herbs helped to quickly cure a bad stomach virus he had contracted while in Guatemala. When he asked a doctor trained in Western medicine if the herb was ever used as an antidote, the doctor told him it was not his way. As the author notes, here was an Indigenous medical knowledge regarding an effective wild herb available to all for free. Yet plant knowledge is in decline. How long would it be before this knowledge was lost because of embarrassment that it was primitive, natural, and Maya, rather than modern, technological, and Western? Although Western nonprofits surely mean no harm, it is vital that they incorporate traditional medicine in with Western medicine so that Indigenous communities do not lose an important part of their culture. If they showcase only the benefits of Western medicine and do not attempt to integrate the benefits of both types of healthcare, the people will begin to utilize only Western techniques, and traditional medicine will no longer exist. Whether they mean to or not, Western nonprofits influence and sometimes threaten Indigenous cultures with their very presence. According to the book Guatemala in Focus, the greatest threat to cultural diversity in Guatemala comes from globalization. Rap music, designer sneakers, television, and other influences are altering Mayan ways of life in rural villages. Simply by wearing Western clothing, eating Western snacks, and speaking English, nonprofit volunteers exert influence on the communities they work with and for. All these factors have at least a subtle effect on the communities who are exposed to them. With time, the communities may begin to adopt some of the cultural elements the Western volunteers bring with them. Is this Western influence threatening to eradicate the very cultures they are trying to help? After spending time in Guatemala, I came to an important realization: that it is not up to outsiders to determine what is best for the Indigenous communities of Guatemala. We have not lived their lives, we have not come from their backgrounds, and we cannot venture to assume that we know what is most needed and most beneficial in their communities. Some people argue that it is our duty to bring Western medicine to those less fortunate. This view is condescending and assumes that Indigenous practices have no value or effectiveness. Others argue that allowing Western nonprofits to help Indigenous communities is destroying their culture. While this also has merit, is it not also condescending to assume that the community would rather have all elements of their culture intact instead of receiving the benefits that outside help can often bring at a cost to some cultural elements? In the end, only the people who would be affected, only the communities themselves, can decide what is best for the community involved. Only then will Western nonprofits be able to do the most good.